We have all joked about having a senior moment when we misplace our keys or walk into a room and forget why we are there. In the medical world, this type of mild, occasional forgetfulness is often a normal part of the aging process, known as age-related cognitive decline. It happens because the processing speed of the brain naturally slows down over decades, much like an older computer taking a few extra seconds to open a file. However, there is a dangerous misconception that all memory issues are just part of getting older. This belief causes many people to ignore red flags. The most critical distinction you need to understand is the speed of onset. Normal aging and even conditions like Alzheimer's disease are typically slow, progressive processes that happen over years. If a loved one is fine on Tuesday, but suddenly confused, disoriented, or forgetful on Wednesday, this is not aging. This is a medical emergency, often classified as delirium. And unlike dementia, it is frequently reversible if treated immediately. One of the most common, yet surprising, causes of sudden confusion in adults over 60 is a urinary tract infection, UTI. In younger people, a UTI presents with obvious physical symptoms like a burning sensation or a frequent need to urinate. However, the immune system of an older adult responds differently. As we age, our immune response becomes less robust, and the typical fever or pain might be absent. Instead, the infection places a systemic stress on the body, releasing inflammatory cytokines that can cross the blood-brain barrier. This results in a sudden change in mental status. A senior with an undiagnosed UTI might suddenly not recognize their spouse, forget where they are, or become agitated. Families often fear this is the sudden onset of dementia, but a simple urine test and a course of antibiotics can often restore their mental clarity completely within days. Another major culprit behind sudden memory lapses is polypharmacy, or the use of multiple medications. Specifically, a class of drugs known as anticholinergics is notorious for blocking acetylcholine, a neurotransmitter that is essential for learning and memory. Many common drugs that seniors take, including over-the-counter sleep aids, allergy medications like diphenhydramine, and prescription drugs for bladder control or depression, have anticholinergic properties. An older brain is less able to process these chemicals. If a senior starts a new medication and suddenly seems foggy or forgetful a few days later, it is highly likely that the medication is dampening their brain's chemical signaling. This is often called medication-induced cognitive impairment. The good news is that this is not permanent brain damage. Consulting a doctor to adjust the dosage or switch medications can essentially unclog the brain's memory pathways. We must also discuss the cardiovascular connection, specifically transient ischemic attacks, TIAs, often called mini-strokes. A TIA occurs when blood flow to a part of the brain is briefly blocked by a clot that subsequently dissolves. Unlike a full stroke, the symptoms might last only a few minutes or hours, which makes them easy to dismiss. If a memory lapse is accompanied by other subtle signs, such as a brief weakness in one hand, slurred speech, or sudden vision changes, it might actually be a TA. In this scenario, the memory loss is actually a sign that a specific part of the brain was temporarily starved of oxygen. Ignoring this is dangerous because a TIA is the body's final warning before a major stroke. If memory loss hits like a lightning bolt, sudden and specific, it requires an immediate trip to the emergency room, not a wait-and-see approach. Nutritional and hormonal deficiencies also play a significant role in reversible dementia. The brain has strict hardware requirements to function, and two of the most critical components are vitamin B12 and thyroid hormones. Vitamin B12 is essential for maintaining the myelin sheath, the protective coating around your nerves that ensures fast signal transmission. As we age, our stomach acid decreases, making it harder to absorb B12 from food. A severe deficiency can mimic Alzheimer's disease, causing memory loss, confusion, and even paranoia. Similarly, an underactive thyroid, hypothyroidism, slows down the body's metabolism, leading to a sluggish brain, often described as brain fog. A simple blood panel can identify these deficiencies. In many cases, B12 injections or thyroid medication can act like a system reboot, dramatically improving cognitive function that was thought to be lost forever. The takeaway here is that sudden is the keyword. The human brain is resilient. It does not typically break down overnight without a specific cause. If you or a loved one experiences a rapid decline in memory or thinking skills, do not accept it as a consequence of age. It is likely a signal of an underlying treatable condition, whether it is an infection, a medication side effect, a TIA, or a vitamin deficiency. By acting quickly and treating the root cause, you can often reverse the memory loss and protect the brain from long-term damage. You have to be the detective for your own health, realizing that sudden means medical is the first step in that defense.